On September 3rd, Governor Gretchen Whitmer ordered the Michigan Department of Health and Human Services to create emergency rules banning the sale of flavored nicotine vaping products in retail stores and online. Days later, President Trump followed with a nationwide ban and encouraged the Food and Drug Administration to investigate the product. And the story isn't over, and it's changing quickly. And now the courts are even involved. To discuss all aspects, we have four guests. Cheryl Phillips from St. Joseph Mercy Health Exploration Station, Wayne County Health Department Medical Director Ruta Sharangpani, and Midwest Independent Retailers Association Juan Escareño, and Deputy Police Chief Brian Miller. All of that is next on In the W. There are so many different aspects of vaping, the ban and the health issues. The bans across the country have occurred due to the rash of illnesses reported nationwide. More than 1,000 people have reported symptoms linked to vaping illnesses, and 28 deaths have been connected to vaping as of October of this year. Many of the lung problems were linked to THC-inclusive vaping products. To talk with us about public health concerns is Cheryl Phillips, coordinator of the St. Joseph Mercy Health Exploration Station. Cheryl, welcome to In the W.
Thank you. Happy to be here.
Well, we appreciate you coming in on this very important topic. So let's just kind of start right at the beginning. Cheryl, for those folks that don't know, what is vaping and what does a vaping device look like? So if there's parents out there that not really sure, they see something around the house. So can you tell us about vaping and what the devices look like?
Sure. Vaping is actually a slang term. What vaping is the use of an ENDS unit, ENDS, electronic nicotine delivery system.
Okay.
So these products were developed in China in 2004 and they came to the United States in 2006. And when they originally came, they looked like smoking devices. They looked like pipes and cigars and cigarettes. And then they have evolved over the time. And now vape apparatuses can look like anything and everything, from cell phones to USB ports to markers to pens. I've even seen one that looked like an asthma inhaler and one that looked like a watch.
Okay. Boy, that's pretty scary.
It is.
So what type of percentages, what are you seeing out there? What type of percentages do you think of young people that are currently vaping, and when do kids start to get exposed to this?
They can get exposed in middle school. I've even heard of some elementary students being exposed to it. So we have about 500,000 middle schoolers, about 3 million high schoolers across our country who readily admit that they have actively used in the last 30 days.
Okay. So one of the active ingredients of vape products is nicotine, and I think we all know that that's highly addictive. Is that correct?
Absolutely, especially to the teenage brain. And I think that's the one point we try to hammer into kids when we go to talk to them, is that their brain's still developing. It's not fully mature to the 25 years old. So any chemical they put into it, nicotine or anything else, is going to have a negative impact on the brain. And the research shows us this, that nicotine can be very addictive to the young brain as it's growing. If it gets in there, that's why we have so many adults who try to quit smoking and can't, because that nicotine's stuck in that brain.
So at the younger age, are children more addicted? I mean, is it easier to get addicted at a younger age as opposed to?
It can be. I've read some statistics that usually with, not usually, but often with one exposure, the brain can already start craving that substance. So
vaping actually comes in it's like a liquid form. So besides nicotine, what else is in this? I don't want to call it a juice, but I can't think of a better name for it. So what else is in this mix?
The main ingredients in the vape juice is propylene glycol, vegetable glycerin, the nicotine, and then the flavoring agents. But then the problem is that when that's heated up and the apparatus gets really warm on the inside, those convert because it's a chemical reaction. So we're finding coming out of the top of a vape apparatus, we have what they call volatile organic compounds. Things like toluene, which is in paint thinner, formaldehyde, which we preserve dead bodies with, benzene, which comes out of car exhaust. So those chemicals plus pieces of metal from the way the apparatus operates, as well as other ingredients that can come out because of the chemical reaction, really can have a negative impact on the person.
So do we have any idea now in the healthcare industry, what the long-term effects on this are? I mean, are they reversible, or is there anything you can share with us there?
Unfortunately, that's the big unknown. That is the million-dollar question. 10 years, they've only been around 10, 12 years, and that's not enough time to do long-term research on the negative health effects. And when we compare this to cigarette smoking, it took us nearly 80 years to determine that that was dangerous for the human body. I don't think it'll take that long with vaping, but it's going to take more than 10 years. So another 5, 10, 15 years from now, we will have more concrete data, and we will be able to say what the negative health effects are. Right now, it's just a gamble that anyone who uses this product is taking because we just don't know.
Is it too early to tell what the difference between health effects between teens and adults is?
It is too early to determine that. We just don't have any research or data to be able to compare yet.
Okay. Well, let's talk for a quick minute about the St. Joseph Mercy Health Exploration Station. Let's talk about the work that you guys do.
Thank you. We are in the Canton Health Facility, and we are a field trip destination. So school groups come to us preschool through high school for a variety of health programs, from hand washing and toothbrushing to substance abuse prevention. And then we take programs out to the schools too. Like we have our Vaping 101, What is Important to Know program. We will take out to schools, middle schools and high schools, and talk directly to the students about this topic.
Well, you guys actually have an event coming up here in the Wayne Westland schools, don't you?
Absolutely, yes. November 6th at 6 o'clock at the Ford Technical Career Building Center. Thank you. They're offering dinner at 5:30, and the program starts at 6 o'clock, and anyone in the community, teens and parents, are welcome to attend.
All right, well, we appreciate that. We appreciate you coming to town. And yeah, the Career Technical Center, it's a mouthful. Back when I went to school there at John Glenn, it was just called the Votech Center. So
that's much easier.
It's evolved over the years. So, well, we appreciate you coming in, Cheryl. I can tell you that I have 3 children of my own. I have a senior, and I have 2 daughters. One's in 9th grade and 7th grade. And, we talk about vaping with them, and I think that the schools have done a good job of trying to educate students. It does seem like the kids know who the kids that are doing this are. So is there anything out there for parents? I mean, what's the message that we should be telling our kids at home? And sometimes kids have the ability to maybe say something to a friend that will actually have more effect than their parents. So what's the message for parents at home to tell their kids?
I think the big thing is just for parents to start the conversation with kids, to stress their disapproval of it, talk about other options they can do. A lot of kids will say they start using this because of stress, and then later on they say they're stressed because they can't use. Yeah. And so talking about other ways to deal with those issues that teens have other than using any substance to escape. As well as talking to our younger students about peer pressure and being able to say no and how to say no. If a kid comes up and offers this to you, this is what we should do, and role play with them so that they are prepared when that happens to them.
So do you have any advice? I mean, what if your child's doing this stuff and they're addicted? And it's easy for parents to take it away from them, ground them, don't let them hang out with those friends, though. What about if they're addicted? Do you have any advice there? Or?
There is resources that are available for people to help. I encourage them to talk to the school counselors, to talk to their pediatrician, as well as go online. The Truth Initiative is a great resource for parents. It has tips on helping them work with their youth to be able to quit. So there are resources out there, just to reach out and find them.
All right, well, we appreciate it. Cheryl Phillips, the coordinator of the St. Joseph Mercy Health Exploration Station. That's a mouthful, too.
That is, too, yes.
All right, we appreciate you coming in. We appreciate the good work that you're doing, and we're going to help promote your event here in the Wayne Westland schools next month.
Thank you.
All right. Well, stay tuned to In the W. We're just getting started talking about this new vaping epidemic and all that's going on around it, and we'll be right back.
Coming up next, Mayor Wild sits down with the medical director for the Wayne County Health Department to talk about information they're releasing to the public about vaping.
Look at you. You're at the top of your game. At work or at play, you're unstoppable. Nothing can throw you off track. Oh, hey, she's cute. Nice going, man. Things are going great for you. You've earned a night out. Good drinks, good friends. Yeah, we can go ahead and call this a good night. Wait, is that your car? Uh-oh. Not smart. Yeah, I saw that coming. Say goodbye to her. Ouch, that'll hurt your bank account. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. I hope you like eating frozen dinners. Alone. Let's try this again. Smart move. Because buzz driving is drunk driving.
Health departments at the federal, state, and county levels are issuing warnings and providing information about the dangers of vaping. Joining us now is our Wayne County Health Department Medical Director, Ruta Sharangpani. Ruta, welcome to In the W.
Thank you.
So Ruta, you're currently doing double duty now. Besides being the director for Wayne County, you're also serving as the director for the city of Detroit as well?
Yeah, I'm their acting medical director while they're looking for someone to do a full-time job, which
All
it
right.
could be.
Well, we appreciate that, and you're doing a wonderful job. So Ruta, on October 15th, Judge Cynthia Stevens of the Michigan Court of Appeals, she blocked the state's ban on e-cigarettes and vaping, saying that it's likely that vaping is a public health concern, but she sided with retailers, saying that there was no need for Michigan Governor Gretchen Whitmer to use her emergency powers to stop their sale. She added that businesses had provided evidence that they would suffer financial damage due to the implementation of the law. So with that said, is the health department commenting on that decision? And what do you feel about the judge putting finances over health?
Our main thing is to get information out to the public about vaping. So I won't comment on the decision itself, but we want to make sure that people, whether they vape or not, have all the information they need to make good decisions.
So that was very diplomatic, by the way. So no, we appreciate that, and this is something that's evolving every day. Mm-hmm. But we'll stick to the health side of it. So what are some of the warnings that the health department is currently issuing due to vaping?
What we're doing is actually putting together a website. If you go to our website and search vaping, we have some great information, some links to the CDC website that gives information about what the products look like for parents, what's in some of the products, so that particularly young people, but also their parents and educators know what kinds of exposures there might be with vaping.
So at this point, what do we know about vaping and what don't we know yet?
Well, we know a couple of things. We know that there have been almost 1,500 people who have become ill with serious lung illnesses, many of them hospitalized, and many deaths also from this over the last few months. So that's extremely concerning, and this affects people of all ages, actually. I mean, when I looked at the data, it was anyone from 17 to, I believe, like 75 were the ages that they have seen nationally. And we've seen something similar here in Michigan. So that's one concern. And of course, when we think about any kind of drug use, particularly with young people, with teenagers, I worry about both their lungs and their brains, and trying to make sure that they don't have the exposures that could hurt them.
So you mentioned data. So what type of data are you collecting and gathering, and what are you sharing with the public?
So as I said, for the public, we're definitely linking to more national data sets so that people can see. In terms of our data gathering, our job is actually to follow up on a lot of those cases around vaping. And a lot of the things we're trying to help figure out is what is causing those illnesses. We don't know. We know that THC may be part of it, nicotine may be part of it, but in terms of a specific chemical, a specific thing we don't know. And so a lot of that data gathering goes into interviewing and asking people, which products are you using? Have you added things to the products? Where are you getting them from? So we can try to track those things down and help both CDC and FDA do that.
How closely is the Wayne County Health Department working with the state on this issue?
Very closely, extremely closely. We are in conversation with them pretty much on a daily basis on this.
All right, well, we definitely appreciate that. So, is the issue really the flavors? I mean, I know there's been a lot of attention that certain flavors were pulled off the shelves as part of the early ban. Is it the flavors or is it the marketing, you think, that's the marketing of the flavors to the youth?
I don't know, but when I look at it, I think about it in comparison to things like candy, for example. Flavors attract younger people, and the colors of the devices, they're brightly colored. The flavors make vaping products taste better than regular cigarettes. They smell better, they taste better, so that's definitely going to probably attract a younger group of people. So whether they're marketed to those people or not, I think it's definitely attractive to them.
We hear people say that there's flavored alcohol, that there's cotton candy flavored vodka, and what's the difference between using flavors for alcohol for flavors for this?
I think it's partly the messaging that has occurred in the last 20, 30 years, where we have talked to kids for a long, long time, both about alcohol and the dangers of drinking when you're young, and also the use of regular tobacco products, so cigarettes. I think they are very averse to using regular cigarettes because they have grown up with all of the things that say, tobacco products are dangerous, but they don't make the distinction, or they don't have the understanding that nicotine, regardless of whether it comes from a cigarette or a cigar, or if it's part of their vaping apparatus, that those are actually in a lot of ways to their brain, it's exactly the same thing.
So as our Wayne County Health Director, what's the message what is it that you want parents to know about vaping?
Well, I want parents to be aware that it's out there, that the devices definitely can look like a lot of other things, as other people have said, like USB drives, like pens, that they should talk to their kids early about all drug use, including vaping, and teaching them that yes, these vaping products have nicotine, they may have THC, and that they're not necessarily safer than cigarettes. We do not know that. That's one of the things we don't know, is how safe or not safe they really are.
So does the health department have information for parents available on the website, or anything that they can reach out if they want to learn more about it?
Absolutely. It'll be part of our website.
Very good. All right, well, I know that this is not the only thing that you're working on. You stay extremely busy. Are there any other health issues that you're monitoring that you want to share with us here today?
Well, I will remind everyone that flu season starts October 1st. And so I will remind everyone to get their flu shot. Everyone 6 months and older should get their flu vaccine every year.
All right, so even though October 1st is come and gone, should you still get a flu shot if you haven't got one yet?
Yep. We say all the way through when we basically run out, but the flu season, they have to have an official start date so they can count data mostly. Sure. But we haven't seen too many cases yet, so you are not too early and not too late.
All right, well, very good. So there you have it. It's Ruta Sharangpani. She's our Wayne County Health Director. She's doing a great job, doing double duty, also helping out the city of Detroit as they look for a full-time director. So thank you for taking time out of your busy schedule to join us here on In the W.
Thank you.
All right, we'll see you soon, and we're going to be right back with more of In the W.
Our next guest will give us the business and policy perspective on vaping.
Listen to me. I am captain of the track team. And if I'm late,
She doesn't really think she's going to get out of here, does she?
Be nice, she's new.
Hello, is anyone there? Ugh!
Wow. Even from our standards, you look awful.
Oh, sweetie, what happened?
Me? My friend Becky got to talk to this super cute boy, and I tried to act like I wasn't jealous, but I so totally was. And then out of nowhere, this concrete barrier just popped up. Maybe it was a semi.
You mean you were driving?
Yeah. I mean, I know the whole eyes on the road thing, but this was a super important text. Maybe you have to know, Becky.
Texting? Great.
But it was only like 5 seconds, and I'm a really, really fast texter, so it wasn't even a big deal. Actually, has she texted me back yet? Wow, I get like no bars in this place. I wonder if they have Wi-Fi here.
Judge Stevens, who lifted the ban, noted the effect it had on local businesses. To talk with us about the retail industry, as well as policy and regulations, is Juan Escareño from the Midwest Independent Retailers Association, also known as MIRA. Juan, welcome to In the W.
Thank you for the opportunity.
So Juan, you represent the Michigan Independent Retailers. So what position is MIRA taking on vaping and the ban?
Well, we believe it's an industry issue, and just like nicotine and other products that have nicotine, it's something that should be regulated by the industry as well as those who have in the past regulated nicotine. So that's our view on vaping as of right now.
Well, the governor certainly moved quick with declaring an emergency, but Judge Stevens, her recent ruling lifted the ban. I mean, were you surprised with the judge's ruling, and what were your thoughts on lifting the ban?
I was a little surprised. It is a temporary lifting, so I could foresee it coming back. And at the end of the day, the governor is looking out for the public health of her residents, so I could understand. We could understand where she's coming from with that angle. So I think there is a change that's going to come with vaping, and especially with a product that may be geared towards towards children and so forth. It might be a necessary change.
So what are some of the concerns for retailers? And I got to tell you, as being a former small business owner myself, it's got to be pretty tough for a legal business to have their shelves stocked with legal product, and all of a sudden overnight you're potentially out of business. So what's been some of the concerns of the retailers?
First and foremost, it is a product that has great margins for some of the retailers, and so of course it's gonna hurt them in the meantime. But as the market adjusts and as they diversify their products, they should be able to bounce back. At the end of the day, it's not about, for us, regulation and laws aren't about keeping people in business, but making sure that the playing field is fair. So how do we keep the playing field fair, and how do we make sure that public health is at the same time a part of the rules and regulations that are being pushed forth. So as the market adjusts, I think most of them will probably be okay.
Well, I know that the members of your association, these are good retailers. These are people that want to do things the right way. There was a local TV report about one business in Westland that actually the distributor came and pulled everything off the shelf that was part of the ban, and the retailer said it was over $100,000 of inventory that they came in and took out. So it's got to be pretty tough for a business owner you're trying to make payroll and everything else. So. It's great that they have an association like you that they can lean back on, and that you guys you have a relationship at the state and local level. So with that said, how do you strike a balance between business and health and safety on this?
Well, first and foremost, health and safety should always come first, right? It's for myself, for my family, for my community, and so forth. So that should always be paramount. And at the end of the day, I believe that's what the governor's intent has been. And and with that said, should there be some regulation? Yes. And our whole position is, as long as the regulation is fair and across the board, there shouldn't be an issue once all this is settled.
So Juan, I mean, I know not all your members sell this product, but do you have some members that sell it? I mean, do you know what percentage it is, or?
We do have members that sell it. I couldn't give you a percentage of how many sell it.
Okay. So what's been your message to them? Always
follow the law, be compliant, and at the same time, it's to be compliant and to follow the rules and be a good neighbor. And at the end of the day, if this upsets people, if this is hurting people, and it's being investigated, we should give it a chance. We should give the health authorities and the policymakers an opportunity to figure out how to make this safe for people.
So what was it like in those that first day or so after this went into effect? I got to imagine that the phone started ringing, and you had to have some members that maybe were concerned that the ban could put them out of business.
Yeah, there was a lot of phone calls, lots of concern, a lot of misinformation. She did give retailers a window of opportunity to be able to move the product they already had, so it wasn't an overnight ban.
Okay.
So they did have an opportunity to move some of to be able to adjust to that to the change. So our job was to educate them and to make sure that they were compliant by the deadline the governor had given.
Okay. So some argue the ban should be on age limits and more focus should be on regulations. Not on adults who use it instead of smoking, because that's been one of the things that we hear is that adults say, I thought I was doing the right thing, that this is how I gave up smoking. So should the argument be more on age limits and additional regulations?
I think age limits for a product like this is understandable, right? I mean, we have an age limit for nicotine. We have an age limit for a reason. That's because there's long-term consequences, right? And at the end of the day, this is a nicotine product, so it should follow similar, if not more stringent rules than regular tobacco. And at the same time, you have a brand new product that's really, we really don't know what the impact is. And so having something that's regulated, it's going to be for the benefit of the community.
So Juan, it was just a few years ago that MIRA was instrumental in getting a synthetic drug off the shelves in stores because kids were misusing it. It was being presented to them that it was incense, but it was I believe it was synthetic marijuana at the time. You jumped right in and you got involved. So why are issues like that in this vaping issue? Why are they important to MIRA?
It goes back to being a good neighbor, and it goes back to the common good. How do we? At the end of the day, these are the neighborhoods we live in, we service through our stores, and we want to be good neighbors, and we want to. We're there for the benefit of the community, and if we see something is hurting our community, it's our responsibility to speak up and make sure it doesn't. See if we could end it at some one way or another. So we're not against regulation. We're per se. We're always in favor of good regulation. Good regulation that's going to help. That's going to help the people and as well as the store owners.
Well, you're also a big believer in good policy, and I know that MIRA is the voice for independent retailers in Lansing. So, can you maybe share with us some of the policy ideas you have and about regulations and some of the laws that are being researched or introduced regarding this vaping issue?
Well, right now we ourselves we're allowing the governor and as well as the FDA and everyone else to figure out what are they going to do with it. And once the FDA, because the FDA was already supposed to have been involved in this, and the governor took the initiative because I think rightfully so. There was some lag time from the FDA, and so we want to see what they do. And at the end of the day, they have the data. They have a grasp of how the industry's working throughout the whole country, and we want to see what they do first.
Okay, all right. Well, with that said, is there anything else that we didn't cover that you want to mention? Any other work that MIRA is doing that you want to talk about?
No, other than we are independent retailers. We are the small mom and pop businesses and the family-owned businesses. And at the end of the day, a lot of the times the products we sell are sometimes through our own family members. And so
Right.
this is something, so when the governor stepped in and said, hey, this could be a public health crisis, it's not just to our customers, but it's also to the people that we work with and we live with and so forth. So I think, personally, I commend her for doing that in the first place. So.
All right. Well, we certainly appreciate you being here with us today. Appreciate you working with the governor, and also you guys. Juan said it first, is that health always comes first. So we appreciate that, and we appreciate you have members of MIRA that are here in the city of Westland.
Yes, we do.
That have made major investments, and they supply jobs for our residents and also great places for people to pick up products. So we appreciate that.
Welcome.
All right. Okay, well, we're still talking vaping here on In the Debbie. We're going to take a short break, and we're going to come back and talk with the Westland Police Department.
Talking about how our police department is working with the community, coming up next is our own Deputy Police Chief, Brian Miller.
Here's your check.
Oh, you got it. You know, since I got rid of my car, I really enjoy walking.
Okay. God, no.
Getting pulled over for buzz driving could cost you around $10,000 in fines, legal fees, and increased insurance rates.
Oh, you're home early.
You live with your mom?
That'll set your game back a few years. Buzzed, busted, and broke. Because buzz driving is drunk driving.
On the day the ban went into effect, our police department went to work door to door reminding local businesses of the ban and handing out information. Not all of our residents appreciated their efforts. We're going to be now talking with our own Deputy Police Chief, Brian Miller, about the Westland Police Department's efforts. Welcome in the W, Chief.
Thank you, Mayor.
So, Chief, the day the ban went into effect, your officers that were on the road, why don't you share with us what they were doing that day?
Well, the day the ban went into effect, obviously there's public health concerns with the law that was enacted. And anytime there's public health concerns, the police department wants to be proactive in getting the word out there to make sure that our merchants were complying with the new law and that they were educated on what that law was. So that was the main point of that first day and our subsequent days of follow-up, was to get out, educate the merchants, make sure they were compliant with the new law, and just make sure our residents are safe.
Well, I appreciate you doing it, and I think we saw that day because of some of the media coverage we got, is that Westland really took a leadership role in that. We were one of the communities that really were out there on the first day, and I know that both the City of Westland and the Police Department both shared their efforts on social media. And not all the responses were in favor of it. There were a lot of people that thought that we were giving businesses a hard time, that we were wasting time, that we should be focusing on other things. So, you know, what did it feel like that day as you started to see the responses kind of coming on both sides of it?
Well, being the police department, we're kind of used to being the visual the visual end of all the laws that are put into effect, whether they're popular or not. It comes down to the police department to enforce those. So it's kind of, you know, we're kind of used to that. We're not always going to be the popular people when we show up, but we have a job to do. And so that's what we were focusing on that day, getting out there and talking to our store merchants and educating them. We actually found that we had a positive reaction from the store merchants. The merchants had known what was coming and were pretty much compliant right off the bat when we went in there. So it was a good opportunity to get out, make contact with some of our business owners, and kind of talk about, you know, the ban in general and kind of what we expected of them as store owners in our city. But yeah, anytime you have a situation like this, that's, you know, you're going to get both sides, and unfortunately, we're kind of that last line of defense, if you will.
Well, I appreciate you guys taking the lead on it, and I think it's worthwhile to say that you were out there on an informational basis, that you were working with the retailers. And in Westland, we talk a lot about community policing, and in my in my thoughts, that's exactly what you were doing. It's not always with the residents. A lot of times you're interacting with the businesses, and with you guys being in the businesses, making sure that the people are doing the right things. And it was an informational thing. It wasn't that you were out there writing tickets or anything. So overall, the response was pretty well from the businesses, and did it seem like most of them had already known about it?
Yeah, I think there was a good public information campaign behind this law coming out. Obviously, the merchants have a vested interest in this, with it being their business. So, yeah, it was an informational type of visit. We didn't go out with the intent to enforce things right off the bat. We wanted to gain voluntary compliance, which is really the goal of all our enforcement, whether it's this or speeding or anything. It's just to make sure people voluntarily comply.
All right, well, Chief, so now we've talked about it earlier on the show that the Court of Appeals now has overturned the ban, and I know that the governor's next step is that she's going to see this thing all the way to the state Supreme Court. So is this something that the department's monitoring, and if something changes, would you guys prepared to step up your efforts?
Yes, so law enforcement, it's a very fluid field. There's court rulings that come out all the time that we have to keep on top of, and that's something that we do at the department. Is we monitor legal updates, we monitor the news to see what comes out, and we adjust. That's what we do. So if this ruling is reversed, then we'll kind of roll with the punches and do what we have to do to make sure, once again, our citizens are safe, our kids are safe, and that our businesses are compliant.
All right, well, we talk a lot about public safety, and I think the police officers through these efforts, shows that you're concerned about health safety too. So I appreciate you being involved, and on today's show, we tried to show that on this topic, and it's something, this topic's not going away. There's a lot of debate on both sides of it, but it shows the cooperation from the federal government, state government, local health departments, our hospitals, and also with our public safety officials that are on the street. So there's a lot that goes into this, but sometimes it's nice to see those lines all working together. And I know that the judicial system is going to have a say in this, but at the end of the day, I think everybody's just trying to do the right thing here for our residents, and for, in this case, our youth. So. Yes, and that's, I think, one of the things with our business community. The response from them has been great. They've been compliant. They know there's a process that has to be worked out. So I have to kind of give a hand to our business community for really kind of stepping up and not forcing us to take that next step as far as enforcement goes. All right, Chief. Well, we know you're busy. You got a lot going on today, so we appreciate you spending a few minutes on this very important topic in the W. No, glad to come in and talk about it. All right. Well, with that said, we appreciate all of our guests who are experts in their field for offering their insights today on this issue that affects so many people. We're going to continue to monitor the vaping industry and share with you the information in regards to the next steps at the state level and the Supreme Court as it becomes available. So once again, thank you for watching in the W.